going to switch gears now and get the latest on the coronavirus emergency. There was a grim new record overnight. The U.S. tallied more than 4,000 deaths in one day. But there is some new good news about the effectiveness of the vaccines. Kaylee Hartung joins us from Los Angeles, California with the latest. Good morning, Kaylee.
Hey, good morning, George. The virus, it's in a race with the vaccine, and the virus, it's getting a little bit faster with the help of that new highly contagious variant that's spreading. The risk of infection right now, it's higher than ever, and the pressure that that's putting on hospitals and first responders here, it's crushing. This morning, for the first time since the pandemic began, more than 4,000 deaths confirmed in just 24 hours.
We have had a situation where we now are averaging between 200 and 300,000 new infections per day, and between 2,000 and 3,000 deaths per day. Every day is a new record for the number of people hospitalized with COVID-19.
And now that highly contagious variant of the virus detected in 8 states across the country.
This variant has the potential to throw jet fuel on an already dangerous situation.
And overnight, potential good news on the vaccine front. In a new study that has not yet been peer-reviewed, researchers from Pfizer and the University of Texas have found that Pfizer and BioNTech's COVID-19 vaccine is likely to protect against the 2 new variants. Moderna CEO also offering promising predictions on their vaccine's effectiveness.
We believe there will be protection potentially a couple years.
The CDC reports nearly 6 million doses of coronavirus vaccine have been administered, still dramatically short of the projected 20 million vaccinations by the end of last December. As the virus spreads like wildfire, with infections on the rise in 42 states, a new model finds nearly 60% of COVID cases are likely transmitted by people who don't have any symptoms. In California, on average, there's a new case every 6 seconds. And first responders in Southern California say hospitals here already look like a disaster zone.
It looks like a bomb went off, yeah. There's like people in C-collars, there's people bleeding, there's people stomach pain, there's COVID patients lined up all down the street. You know, it's bad.
Ambulances are waiting up to 17 hours outside hospitals and running out of oxygen for their patients.
Waiting here, our patient they literally had the oxygen tubing and had a connector so that 2 patients were using basically the same oxygen flow at the same time. So resources are really low.
Because that was your best option?
That was the only option.
And with ambulances piled up outside so many Southern California hospitals, some have put a surge plan in place. They'll put 1 EMT crew in charge of as many as 8 patients. That means you put 7 ambulances back on the streets to respond to 911 calls, but that cannot shortcut the wait that some patients may have to endure to get a bed inside one of those hospitals. Michael.
All right, thank you so much for that, Kaylee.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.